James votes no.
Mr. James votes no.
On the Democrat side? Oh, Ms. Harshberger, how's she recorded?
Mrs. Harshbarger is not recorded. Mrs. Harshbarger votes no.
Yes, she did. How's Ms. Houchins recorded?
Mrs. Houchin is recorded as no.
Okay. Is anyone on the Democrat side here? Everybody was, yeah, we're all in your places. So the clerk will call the roll.
Chairman Guthrie, on that vote, there were 24 ayes and 27 noes.
The amendment is not agreed to. So what purpose is the gentlelady from Florida seek recognition?
I have an amendment at the desk. It is Health FCD AMD 126.
The clerk will report.
Mr. Chairman, could the gentlelady please repeat the amendment?
126.
Thank you.
The clerk will report.
Health-FCD-AMD underscore.
Without objection, the reading of the amendment is dispensed with, and the gentlelady is recognized for 5 minutes in support of the amendment.
Well, thank you, Mr. Chairman. This amendment says that none of the provisions of this title shall take effect if any of the provisions result in reduced access to coverage under the health title. And as we bring this debate in for a landing today, I want to say to my Democratic colleagues, I'm so proud to stand with you. You're eloquent and fearless. And to Chairman Guthrie and my Republican colleagues, I want to thank you. I appreciate your respectful tenor of the debate. But we've learned a lot since the Republicans sprung this cruel and costly tax and spending package on Americans late in the dark of night, on Mother's Day no less, rushing it to committee without a hearing, shrouding the health care debate, starting that at 1 a.m. in the middle of the night. But here's what we know. Almost 14 million Americans will lose their health coverage to give the richest Americans a large permanent tax cut, while working families will see eventual tax increases. They're going to add $5 trillion to the debt. It's fiscally irresponsible, and it is morally wrong. 14 million Americans. That's the combined population of the states of Kentucky and Virginia. Some of the largest health care cuts ever proposed in American history, harming not just our neighbors, but providers, doctors, nurses, hospitals, therapists who provide care. So this is going to impact all Americans. Here's how. They're going to bury people in costly paperwork. You slip up, no care. They're going to make it harder to enroll, no care. They're going to shrink the enrollment periods, no care. They're going to choke off the ability of states and providers to fund care. So no care there either. They're going to raise premiums and price people out so they lose care. Eligible parents and families will be forced to jump through hoops when instead they should be focused on setting their kids up for success in life. It will be harder for families to access long-term care or stay in their homes and live in dignity. Now, at the outset of our hearing that began over 24 hours ago, the Democrats highlighted folks back home who rely on Medicare or Medicaid. And the Republicans protested. They said none of those people are going to lose their health care. Well, here's what we know. The nonpartisan independent CBO says 14 million Americans will lose care. And why won't people believe what the Republicans are saying? It's because the Republicans have a track record of opposing affordable health care. While Democrats have championed the health of our neighbors, we do not believe that you should be bankrupt if you get a diagnosis. This is smart policy. We want people to be productive and healthy. In fact, you can go all the way back to the 1960s when it was a Democratic president and a Democratic Congress who originally passed Medicaid and Medicare into law, or maybe something more in the modern era. 2010, when a Democratic president and a Democratic Congress, as the rolls of the uninsured reached 25% in the state of Florida, We passed the Affordable Care Act to outlaw discrimination for pre-existing conditions. We passed a law that said kids can stay on their parents' plan till age 26. We expanded Medicaid.
I expect this will.
21
we're starting
million
to wrap up
Americans
now.
now have health coverage because of Medicaid expansion. That ultimately cut the uninsured rate in half. We're now at a historic low in the number of uninsured. We were constraining spending. But see, the Republicans have a track record because they fought it every step of the way. There wasn't one Republican vote for the Affordable Care Act. And then go to 2017, the first Trump administration. Republicans in this committee fought to repeal the ACA. Contrast that to the Democratic record. We passed the Inflation Reduction Act, key reforms to lower health care costs, direct Medicare to negotiate prices for the highest cost drugs. We capped the price of insulin at $35, a $2,000 cap for everyone on Medicare, and enhanced premium tax credits. The track record again, not one GOP vote here. In 2021, in the midst of a maternal mortality crisis, we gave states a new option to provide Medicaid, postpartum coverage. In 2025 now, here at the outset of this Congress, the Republicans are turning a blind eye. They're going down the same old path to rip health coverage away. It doesn't have to be like this. People in America deserve affordable, reliable care. And that's what we intend to fight for. From this day forward, no matter if you pass this bill out of this committee, we're not going to give up. We're going to stand up for our neighbors back home. See them, listen to them, empower them, support them. Don't rip away their coverage to fund a massive tax giveaway for the
The
wealthiest.
gentlelady's time has expired.
I yield back my time.
The gentlelady yields back. The chair will now recognize himself to speak on the amendment. So the American people need to know what my Democrat colleagues are prioritizing. When they say they're against any coverage loss, what they're really saying is 4.88 million people who refuse to work, a part-time job, or volunteer in their communities are entitled to free health care paid for by hardworking taxpayers. When they're saying against any coverage loss, what they're really saying is that the 1.4 million illegals who are a drain on our healthcare system should be prioritized over U.S. citizens. And when they say they're against coverage loss, what they're really saying is that people who aren't actually eligible for Medicaid should be prioritized over children, mothers, or people with disabilities who this program was designed for. Let's be honest about who we're fighting for here today. House Republicans are fighting for America's children. We're fighting for pregnant women and mothers. We're fighting for individuals with disabilities. And we're fighting for the seniors who need long-term
House
care.
Republicans voted
We believe
against
this is who Medicaid
amendments
is intended for,
that would have
not
protected
illegal immigrants,
home and
not
community-based services
able-bodied adults who choose
and
not to
people
work, not
in
people
nursing
fraudulently
facilities.
enrolled. We want to root out the waste, fraud, and abuse in the system and make Medicaid stronger and more secure for generations to come. And I will yield back, and we'll recognize the ranking member for 5 minutes to speak on the amendment.
Thank you, Mr. Chairman. Mr. Chairman, I think there's a fundamental disagreement here about what this bill does. It's clear to me that, contrary to what you say, this is very much like the Georgia situation. And that is that you have a group of people, in the case of Georgia, I think it was about 400,000 Georgians, and you had something like 5,000 of them that ended up being covered by Medicaid with all this red tape that you put forth in this bill. Now you say, well, only those 4,000, probably were eligible. And I would say no. I think the 400,000 were eligible. But the problem was you put so many roadblocks in their way, or not in this case, in the case of Georgia, put so many roadblocks in their way and spent so much of an effort not on providing them health care, but rather on making sure that they weren't able to get health care. Now, I'm not trying to say there's anything intentional here. I don't want you to get the wrong impression. The fact of the matter is that if you put together a system, which is in this bill, where people have to constantly face all kinds of red tape in order to, get their health insurance under Medicaid, to the tune of having to file papers every month if the state decides to do that, and then say, oh, don't worry, there are all these exceptions. If you're pregnant, you're an exception. If you're disabled, you're an exception. But again, it goes back to the situation like that in Georgia where people couldn't qualify. They couldn't show that they qualified for these exemptions. So either you miss the actual initial test of whether or not you filed the paper to show that you're eligible, or you miss the test of showing that you're exempt and didn't have to file the paper, but you had to file more paper for that. It ends up that, less than 5% of the people that are actually eligible end up getting on Medicaid. Everyone else is thrown off. And, you can talk about the undocumented and the people that are in 2 different states and all that, but I think we've showed rather dramatically that that's a very small number overall compared to this 13.7 million that the CBO says is actually going to lose their health insurance. And that's not only because of the 8.5 million or so that would clearly lose their health insurance under this bill, but also because of another 5 who will lose it because they'll lose the subsidy because you're not renewing it for the ACA. So if you think that 13.7 or 8.5 million people are not eligible, I mean, you can think that, but I think it's a fiction. The reality is that you're making it so that people who would normally be eligible are not. And then in addition to that, you have all kinds of other things that make the system even more unaffordable, causing people to pay, in certain categories, to pay $35 a month. $35 each time they go to the doctor. Or in the case of nursing homes, reducing the quality of care because you get rid of the nurse staffing rule. There's all these little things that they add up to this almost $1 trillion, of which over 700 billion of that is for healthcare alone. I'm not even getting into the environmental issues and the energy issues and the spectrum issues and other things that we talked about today, because I think the main thrust of this is that you are making it almost impossible for most of the people, for a significant number of the people who would be eligible for Medicaid to actually receive it. And that's not fair. I don't think it's fair to suggest that, that there's any reason for this other than the fact that you're trying to save money in order to pay for these tax cuts for the very wealthy and for large corporate interests. And we as Democrats believe that we should be expanding health insurance and health opportunities. Now, I just want to thank, if I can, all of the people who have stayed with us all night fighting for their health care and the health care of their families and neighbors. I do believe the voices of the people in the audience are powerful, and Democrats will do everything that we can to protect your health care, and we will win this fight. And lastly, Mr. Chairman, if I could say, we have about 200+ letters expressing opposition or concern with this Republican bill, representing thousands of organizations, and I would ask that that be entered into the record. I'm not going to throw this book at you, but
I don't see any,
I'll give it to the,
throw the book at me. I don't see any objection.
and I yield back. Thank
Gentleman
you.
yields back. Are there any others seeking recognition? You ready? The gentleman from Texas seeks recognition to speak on the amendment.
Thank you, Mr. Chairman. I move to strike the last word. I want to commend you on running a great hearing and running a great markup and running a great reconciliation bill. I'm very proud of the work we've done here. There's a specific provision in this bill that I'm particularly proud of. I've been fighting for this for a long time. And I noticed that there's actually no amendments to strike it, which makes me maybe idealistically or foolishly think that we all agree on it. Maybe that's the case now, but this is the provision that ends the use of Medicaid, CHIP, and Affordable Care Act dollars for gender transition procedures on minors. This will become law, and I couldn't be happier about it. And gender transition procedures are the lobotomy of our generation. People look back on this period, I think, with disbelief, and I guarantee it. That gender-affirming care, it's not health care, it's fringe science with no proven benefit and enormous risks. And Americans agree with us, by the way, hence maybe the lack of amendments to strike it, because poll after poll shows overwhelming opposition to giving kids drugs or surgical interventions. And it should also be stated very clearly, the following provision has a direct budgetary effect since it amends the list of payment prohibitions under Section 1903I of the Social Security Act. It limits medically unnecessary procedures, which is exactly what gender transition procedures are. People wonder how we got to this place to begin with. Started in sociology departments, went to med schools, flooded our institutions like the American Academy of Pediatrics, finally landed in children's hospitals. Even though the most recent studies and systematic reviews have effectively debunked this foolish practice, it continues on. A Reuters investigation showed prescriptions for puberty blockers and cross-sex hormones have risen by over 120% in just a few years. This is a textbook social contagion. The truth is that many of these kids are wrestling with issues that kids wrestle with. They have comorbid psychiatric diagnoses. They have fleeting ideations, peer pressure, online echo chambers. It's not a condition that demands a prescription and a scalpel. But instead of asking why that's happening or why it especially affects young girls, we're told to just affirm and fast track. No questions asked. Parents need to shut up and do what the crazy doctor says. That's not care, that's malpractice, and the science doesn't support it. In 2024, the UK commissioned the CAS review, an independent audit by top pediatricians of more than 100 studies on gender transitions for minors. Its verdict? Evidence for puberty blockers, cross-sex hormones, and surgeries is weak at best, and doctors can't predict which children will even continue to experience gender dysphoria. There's no conclusions on whether these
is
treatments
lying.
improve psychiatric conditions or prevent suicide.
He is
Worse,
lying.
only 2 of those 100 studies even met the basic research standards one would expect. They lacked randomized control, they had poor
He's
follow-up rates,
lying
used
in the
sample
same way
populations that
he has been
weren't
lying
minors.
throughout this
Most of
hearing.
these so-called studies
I need you to
resemble narratives
understand
done in
that
real
if you
objectivity.
believe he was
Most of them were
lying
just
about
surveys with severe
Medicaid
selection
paying
bias. The standards of care
for home care,
were actually found to have severe circular referencing on one another as well.
he's lying about this. If you believe he was lying,
These bogus narratives also ignore stories of
if you believe he was lying about no one losing their Medicaid coverage, he's lying about this. He's lying about the existence of transgender people in this country. We're not going away. There is nothing this fascist can say or do that is going to erase trans people from America. I want to be very clear. The claims he's making are false. What their bill would do is prevent medically necessary care on the basis of someone's gender status. What's going to happen as a result if their bill is enacted into law is poor, so kids living in low-income families who rely on Medicaid as their primary insurer are not going to be able to get gender-affirming care. They're not going to be able to get, if you're 17 and you're relying on Medicaid and you want gender-affirming care, it's not going to be available to you.
That's exactly what House Democrats are trying to do by fighting against these Medicaid cuts. I will remind everybody, when there were amendments to protect kids,
15, 16, 17-year-olds
including the person who just said this,
are old enough to know
having a chance to protect the most vulnerable.
if they are experiencing dysphoria.
My colleagues across the aisle have shown that they are not interested. So to hear that
The ban on gender-affirming care is designed
my colleague from Florida
to try
did a great job of outlining
to erase trans people
for public
from existence in this country.
history of
It is designed
Affordable Care Act.
so that trans kids will choose at much greater rates than existing because of the hatred of our society towards trans folks, and because of the unavailability of medical care. I don't know if this is an experience you've had, but there have been times when I've been in so much physical pain, extended, excruciating, overwhelming pain, that if you had asked me in that moment, the only way to make this pain stop is to no longer be alive, yeah, I probably would have taken that option. We do that to kids, 15, 16, 17-year-olds. We torture them now by denying them coverage for medically necessary procedures to stop the pain of dysphoria, and to make it impossible for them as adults to meet the sort of cis normative standards, making it impossible for trans people to meet sort of cis standards of what it means to be an adult.
After 25-hour hearing, he refused to have the health care conversation the day of life. They waited until 2 o'clock in the morning to do it, and they did a total 180. So why can't they be trusted? Because they themselves said months ago during the budget resolution conversation, Medicaid wasn't even in the resolution. They were not going to touch it.
What's happening now is they're hearing a bunch of like summation speeches
Showing how many millions of people
because we are
they're going to
approaching
kick
the
off.
finish
It's not a
line for
totally
this
accurate
markup.
chart. It's
It's
missing
been over
a
24
whole
hours
other
since the
chunk of
hearing
5
started.
million people they want to throw off that are getting the Affordable Care Act, because this is their way of attacking the Affordable Care Act. So let's just remember why they can't be trusted. Let's remember their own words. And actions matter. And these actions in the last 25 hours show us who they really are fighting for. It's not the children, because they voted against them. And they're not voting for it because it costs too much money. And why? Because they got to find places to cut, to save money, to then turn around and give it to their billionaire friends. Because that is who's going to benefit from these tax cuts. The lowest earning people are going to get like 90 bucks. But their billionaire friends, they're going to get a private jet trip, right? So talk about unequal access, who they're really fighting for. It is the rich. It's not the American people. And they had a chance to show that they were willing to do the right thing, to fight for kids, to fight for people to have access to health care, but they just don't believe it. We have a totally different value system, and your budget shares your values, where you're gonna put your money. They'd rather put that money in more defense spending, they'd rather put that money in budget cuts, tax cuts for the rich, instead of investing in our kids, our schools. And when I say schools, I'm talking about even something as simple as fighting air pollution at schools for kids. So I think it's very evident on where they are and why they can't be trusted. And I just want to urge everybody to continue the fight, because this is not over. We're hearing at least one Republican senator who's admitting that this is slashing health care. This GOP plan is slashing health care, and that it's morally wrong and it's suicide. And so hopefully that person can stand up and fight back to stop this from happening. Keep up the work, keep up the fight. We are going to keep fighting. House Democrats will. With that, I yield back.
Thank you. The gentlelady yields back. It's in a discussion on, I have the gentleman from Texas, Mr. Weber, for 5 minutes.
Well, I won't need 5 minutes, Mr. Chairman. Thank you. It's been a great time for us to be here together and working hard together. I have the 14th District of Texas. Most of y'all know that. And there's a gentlelady here from New York who has the 14th District in New York. And Alexandria, you didn't deserve what I hit you with last night at 3 o'clock. So I just...
Oh, well, that's very kind.
Just wanted to say, and I thought I'd get your attention, and I did all right. So I shouldn't have done that, and I apologize, and I yield back.
Oh, well, will the gentleman yield?
Yes, ma'am.
Well, I completely accept, and, you know, these markups, they run late into the night. We're at 3 o'clock in the morning, we're tired, and it is what it is, but we're, you know, we're all here because we're fighting for what we believe in, and I sincerely appreciate the graciousness and generosity with which you extend that, so.
Thank you,
I
ma'am.
kindly accept, thank you.
Thank you.
Any discussions? I know the gentlelady from California, Ms. Matsui, is recognized for 5 minutes to speak on the amendment.
Thank you very much. Mr. Chairman, I move to strike the last word. Mr. Chairman, we've been here for over 24 hours now, and Republicans have rejected every amendment offered today, every amendment that would protect vulnerable patients, every amendment that would reinvest savings into health care, and more. Because they are still claiming, despite the evidence we've laid out, that this bill won't hurt kids, hurt people with disabilities, hurt parents, and millions of Medicaid recipients. So let's be clear. Over 24 hours later, the bill before us would still rip critical benefits away from millions of people. Now, I'd like to bring the focus back to those patients, specifically Nicholas. Here's Nicholas, handsome person. Today, as you see in this photo, Nicholas is preparing to graduate high school and head to community college in the fall. As his mom, Leandra, put it, he has beaten the odds of Duchenne, and without Medicaid, he would not be here today. Medicaid has provided life-changing and life-saving care to Nicholas. For example, when private insurance refused to cover a power chair, calling it not medically necessary, Medicaid paid for it. Now Nicholas can get around without assistance. When you think about it, for an 18-year-old boy, you can imagine how much that independence means. Medicaid also pays for Nicholas to receive the first approved therapy for Duchenne, which has helped him regain his strength. Nicholas can still walk short distances, something that would have been unthinkable, impossible when he was diagnosed. And as Nicholas gets older and needs more help to stay independent, Medicaid pays for in-home supportive services. Republicans claim that this bill won't harm kids like Nicholas, but we're not fooled. And neither are the advocates who have filled these halls, flooded our office phones and inboxes, and showed up in this room all day and night. Thank you so much for being here to fight. I want you to know, and you know this, the fight is not over. Please keep showing up. We're with you. We'll keep fighting with you. This is not over. I yield back.
He yields back. The gentleman from Michigan is recognized to speak on the amendment for 5 minutes.
Thank you, Mr. Chairman. I move to strike the last word. Thank you, Mr. Chairman. I want to take a second to address my constituents and the millions of folks who are across the country who rely on Medicaid. You are being misled. In Michigan, nearly half the seniors rely on Medicaid to age with dignity. Medicaid covers 40% of U.S. births and 38% of Michigan births. The impact of this needed program truly cannot be overstated. We're hearing a lot about fighting to protect Medicaid from my Democrat colleagues, and to be honest, they are fighting to protect Medicaid. They are fighting tooth and nail to protect Medicaid, but not for you, but for illegal aliens, gender transition surgeries for children, ineligible recipients, and able-bodied adults who choose not to work. Democrats are absolutely fighting, but they're fighting for the wrong people. Republicans are fighting to ensure Medicaid is protected and upheld for generations now and in the future. I was recently contacted by Kirsten from Shelby Township, who said, my son has cerebral palsy and relies on Medicaid every single day, not just for health care, but to live with independence, dignity, and purpose. Medicaid makes it possible for him to live outside of an institution. I'm fighting to protect Medicaid so Kirsten, her son, and her family can live together in dignity. I heard from Barbara from St. Clair Shores, who is a special ed teacher who works with disabled students. I'm fighting to protect Medicaid so Barbara's students get the opportunity and an education that they need to thrive and that they deserve. Rosanna, also from St. Clair Shores, said, I'm a pediatric nurse practitioner, and I already hear daily how much my patients' families struggle to meet the needs across the board. I'm fighting for Rosanna's patients. Here's the truth. Republicans are not cutting Medicaid. We're simply prioritizing the people Medicaid was originally designed for. Low-income children, pregnant women, the disabled, the elderly, and the list goes on and on. And so I'm gonna tell you something that you don't hear of too much. Don't believe Republicans, and don't believe Democrats. Use the brain that the good Lord gave you and read it for yourself and come to your own conclusions. Read the words yourself, not what a politician tells you, and you will read for yourself in this bill who is fighting for you. Democrats are doing what they always do, fear-mongering, distracting, and defending failing systems. They're inflating Medicaid with illegals, ineligible recipients, and able-bodied adults who refuse to work. These aren't reforms. They're reckless giveaways that take resources away from the truly vulnerable, the people who they say they're serving. They're leaving behind the kids, the moms, the seniors.
I'm an expert in what I'm about to say.
My colleagues across the aisle say you haven't found any fraud, wasting of
This bill reduces, sort of freezes one of the primary ways states can raise money to pay for their portion of Medicaid. Medicaid is a state and federal partnership. Both the feds and the states kick in money to pay for Medicaid coverage of everyone in the state. They are, in this bill, limiting one of the primary ways, if you're hearing talk about a provider tax, it's one of the ways states come up with money to help pay for their share of the Medicaid program. This restrains states' ability to do that. They'll have less revenue, and one of the first things they'll cut, because we've seen them do this in the past, is home and community-based services, i.e. what pays for home care to allow kids who rely on Medicaid to stay at home. This guy's just lying.
Fighting for patients, they're fighting to protect the status quo. And that's not good enough for people or the folks in my district who desperately rely on us to do the right thing here. We're not buying it. We're not buying the crocodile tears. We are here to fix the problem. So with or without my Democrat colleagues and their inflated numbers, Republicans are going to defend and strengthen Medicaid. We will ensure that Medicaid remains a lifeline for millions of vulnerable Americans, not a loophole for exploitation. With that, Mr. Chairman, I yield.
The gentleman yields. The gentleman yields. Could the room come to order? The room come to order. All right, the room will come to order. All right, the room will come to order. The gentleman from New York is recognized for 5 minutes to speak on the amendment.
Get order here.
The gentleman from New York has the time to speak on the amendment for 5 minutes.
Thank you. Thank you, Mr. Chair. Thank you, Mr. Ranking Member. Thank you to my colleagues on both sides of the aisle and staff. And in a very special way, thank you to those who have brought your stories. They're so powerfully inspirational. Those gathered here, and there's so many that have reached out through the course of weeks and months to be involved in this decision-making. As we wind down this debate, I have a confession to make. I'm tired, and I know we're all tired. We've been at this for more than 25 hours now. And while I am tired, I'm also energized because I know our cause is just. And because I know that these past 25 hours have helped to illuminate the stakes of this debate for the American people. And the stakes, my friends, could not be higher. The choices that are made in this room today and in our House of Representatives will impact the lives of millions of people that we will never meet. In this moment, I'm thinking of how this might impact one family that I have met. Sarah and her son Cameron from Niskayuna, New York. Cameron is a 16-month-old pediatric stroke survivor. Cam was previously normally developing and healthy, but at 7 months old, he had a rare pediatric stroke that changed everything. Sarah shared how they quickly found themselves in a community of parents with disabled kids that rely on Medicaid. Her son receives 5 to 6 therapies a week and goes to 2 to 3 doctor's appointments every month. Medicaid is the safety net that supports them to provide things like copays and medical braces, which add up and make a huge difference. Sarah's story could be any of our stories. She shares with me, and I quote, "It really hits home for me that Cameron became disabled after his stroke pretty much overnight. Our lives changed, so I think what people may be missing here is anyone can become disabled at any moment, and therefore you may not have the coverage you once thought you had." Republicans falsely claim that children like Cameron won't be impacted by their package. But I've read the text, and that's simply not true. New York State stands to lose billions of dollars in cuts to Medicaid from the reduced federal match, the provider tax provisions, and more senseless provision in this cruel package. Again, let me reiterate, when states have to make these massive cuts to their Medicaid programs, where do you think they're going to look first? To the most expensive patients, the elderly, the sick, and the disabled, to the very people that my Republican colleagues claim they are trying to protect. Republicans have been offered so many opportunities today to put pen to paper on their claims that this bill won't hurt people like Cameron. They've refused to do so. When someone shows you who they are, believe them. Here's your last chance. Support this amendment. Let's make an ironclad guarantee to folks like Sarah and Cameron that we're going to take care of them. Let's make that ironclad guarantee that lets this family sleep a little easier tonight. I'm ready to make that promise, and I urge my colleagues to do the same. And with that, I yield back.
The gentleman yields back. Is there any discussion on the Republican side? Seeing none, the gentleman from California, Dr. Rees, is recognized for 5 minutes on the amendment.
Thank you, Mr. Chairman. I want to thank you as well as Ranking Member Pallone and all the members that lasted this 25 hours. I want to thank the people in the attendance who are here, especially those that were with us overnight. And I really want to give a shout out to all of our staff, the Energy and Commerce staff, including all the staff in our individual office. They stayed up with us, they worked with us, not easy. Thank you. So where did we start? We started with a budget resolution that asked this committee to cut $880 billion in order to pay for the tax cuts that are primarily going to go to billionaires in the tune of billions of dollars. And initially they said, no, there's no such thing as Medicaid cuts. No, we're not going to touch Medicaid, all this other nonsense. But in fact, today it was revealed that they're actually going to cut $715 billion in Medicaid. And how are they going to do that? Well, the only way they're going to do that is to try to get people off the rolls, to try to get less individuals who utilize Medicaid, decrease access to Medicaid and health care. And yes, they're looking at individuals who are undocumented, but they're also looking at primarily U.S. citizens. These are people in the Medicaid expansion. And yes, children, disabled, seniors, and pregnant women. So let me break it down in how they too are going to be losing access to health care. Primarily, the biggest factor is the red tape requirement, or the work requirements. Eligible U.S. citizens will get off the rolls because we've already seen and heard in examples through Georgia and others that it is cumbersome, that people give up, and that's the intent. In fact, currently, right now, as we speak, Georgia has only enrolled 3% of U.S. eligible citizens in their state. Only 3% of the people who could use Medicaid have been enrolled because it is so cumbersome. How else will they manage this? Well, they will shift the burden to the states. How, you ask? Well, it's unfunded work requirement, red tape requirement, administrations, unfunded mandates for reportings and verifications, and uncompensated care, and for some states, reduced the federal share. Now, what will states do when this happens? One, they will increase taxes or they will shift monies from other programs. Two, they will decrease benefits. Three, they will decrease eligibility for individuals. And four, they will decrease physician reimbursements, which means that less physicians will take patients on Medicaid. And the uncompensated care that we're going to see rise because 3.7 million Americans will lose their health insurance, well, that's going to increase costs for hospitals. And what else will hospitals do? They will cut programs like pediatrics and labor and delivery. There you go. That's where the children will lose care because those hospitals won't provide pediatrics. And the disabled, same thing. Oh, and labor and delivery, bingo, pregnant women are going to lose their access to care with these hospitals that are going to cut services. And seniors and the rest of us, hospitals will close. And that's how seniors and everybody else, whether you have Medicaid or private insurance, are going to have access to the care that you have now. Don't take my word for it. I read you many quotes from different hospital associations throughout different states and throughout our country. 13.7 million people will lose health insurance. And according to your estimate, 12.3 million U.S. citizens. Of those 13.7 million people, 12.3 million U.S. citizens will lose health care. Costs will go up for everybody. Medical debt and bankruptcy will rise. And this bill is just god-awful. Don't take my word for it. Here's a quote today from Josh Hawley, Senator Josh Hawley. Says this: the cuts in the House GOP's big, beautiful bill, and says it must change to become law. This is real Medicaid benefit cuts. He says, and I can't support that. No Republican should support that. We're the party of the working class. We need to act like it.
Gentleman, time has expired. Thank you.
So I encourage you to act like it.
So gentleman, time has expired. The gentleman from Alabama is recognized to speak on the amendment for 5 minutes.
Mr. Chairman, I rise in opposition to the amendment and move to strike the last word. Mr. Chairman, I just wonder what my colleagues on the other side of the aisle think about Gavin Newsom's proposal to freeze enrollment in Medi-Cal for enrollees 19 and up with unsatisfactory immigration status, and to charge those who do enroll $100 per month premium. I mean, they had a conniption about $35. So I know they must really be in a panic about the Golden State freezing enrollment for 19-year-olds with questionable immigration status and charging them $100 a month. I yield back.
Gentleman yields back. Is anyone on the Democrat side seeking recognition? The gentlelady from New York, Ms. Clark, I'm sorry. Gentlelady's recognized for 5 minutes to speak on the.
Yes, let me thank you, Mr. Chairman. Let me also thank the ranking member and all of my colleagues for a very important and sobering debate. Let me thank our advocates who traveled miles to be here to demonstrate to the American people that when we show up, we win. Mr. Chairman, I have just been overwhelmed by the gaslighting that has been taking place in this room. I want to express my opposition to the provision in this bill that penalizes states like my home state of New York for providing health coverage to undocumented immigrants, particularly our children. New York is home to one of the most diverse populations in the world. We are a state built on the backs of labor of immigrants from Africa, Caribbean, Latin America, Asia, and Europe, all working hard to build better lives, contribute to their communities, and raise their children. This bill proposes a penalty for states like New York that use state-only funds to provide health coverage to these individuals. The reduction in the FMAP from 90% to 80% will result in devastating consequences for our healthcare systems and for New York. It amounts to a loss of over $1.6 billion annually. Furthermore, the provision limiting the reasonable opportunity window for citizenship verification is another misguided attempt to deny people access to health care they desperately need. Federal Medicaid funding does not cover undocumented immigrants, and even lawfully present immigrants face years-long waits for access under current law. But Republicans want to end protections like the reasonable opportunity period, which gives U.S. citizens and legally present immigrants the ability to receive care while their status is verified through the Social Security Administration or the Department of Homeland Security. Past policies show this approach is harmful. Remember the pandemic? Yeah, you should, because Donald Trump knew that the virus was airborne and sat on his hands, as it would cause delays or the denial of coverage due to paperwork issues. Let me be clear. The real goal here is to use immigrants as scapegoats to justify policies that strip health care coverage from millions of Americans in order to put more money in their billionaire donors' pockets. This is not just a policy issue. Our commitment to health care is a fundamental human right. No one should be left without health care simply because they are unable to navigate a complex and flawed verification system. However, we always find the money for tax breaks for the wealthy. But when it comes to health care for working people, suddenly we're out of money. This is a bold-faced and brazen cruelty. Their goal is to shift federal support to their donors' pockets through privatization, contracts, and tax cuts. They are punitive, they are short-sighted, and they will devastate our nation. So no, I will not quietly sit here so that my colleagues can pontificate, gaslight, and everything else on the other side of the aisle as they chip away at the American dream and the need for health care in our nation for the most vulnerable. In one of the wealthiest, most advanced nations in the world, everyone, no matter their political beliefs, deserves access to quality, affordable health care. This is not a fiscal policy. This is a moral failure, and I reject this bill. Yes, indeed, cruelty is the point. And with that, I yield back the balance of my time.
Thank you. The gentlelady from New York yields back. And before I'm going to recognize, I just want to explain where we are. So we're speaking on an amendment. So we'll have to have a roll call vote on the amendment. So that's one. And then we're marking up to an amendment in the nature of a substitute. And so we can adopt that, hopefully by voice, because we'll have to vote on it by roll call. So hopefully we'll be able to do that by voice. So we have a roll call on this amendment, voice the Ains, and then roll call the bill, the Ains. That's where you get your roll call on the Ains. And that's on the committee print for health care. And then we'll have one more vote to bring all the four prints together and report out. So there'll be, unless you call a roll call on the Ains, which is your right to do, but hopefully we won't. There'll be 3 roll call votes when we get going, so just be, so you know what's coming. All right, the gentleman from North Carolina is recognized for 5 minutes to speak on the amendment before us.
Thank you, Mr. Chairman. Well, there you have it, folks. We just heard the explanation. One side is fighting to give Medicaid benefits to illegal immigrants, and our side is fighting for people. I introduced you at the beginning of this hearing about 20 hours ago to Melissa from Burlington, who said Medicaid's a godsend, to Christine from Robbins, North Carolina, who has a special needs son and depends on Medicaid, to Jennifer from Greensboro, North Carolina, who has a disabled daughter. Said Medicaid has helped our family tremendously by giving us the opportunity to give her the care she deserves. I introduced you to Kara from Moore County. Says that she knows a lot of families in Moore County that depend on Medicaid, and her family's one of them. She has a 6-year-old son with a rare disease. These are the people I'm fighting for. I'd also introduce you to Vicki from Fayetteville, North Carolina, who wrote me and said, Medicaid is the only reason that my mother can afford her health care. She's 87 and deals with multiple health issues. I'm fighting for Vicki. That's who I care about. And I'm sorry that the other side for months has been, I think the term I heard a minute ago was gaslighting. I've got some terms here. They've misled you to believe that Republicans are going to cut Medicaid. We didn't. Our chairman went through the bill, explained exactly what our bill does. But you've been misled by the fibs, the equivocations, the palter, the untruths, and the falsehoods. Let me give you some truth. Medicaid is going broke. It's going broke. Our states are going broke. The federal government's going broke. And there's a lot of reasons why. And there's some issues that I believe my colleagues on the other side of the aisle in good faith want to work on. The cost of drugs, access issues. There's a lot of things that we are working on together that we need to do more work together. But another contributor is that President Joe Biden in 4 years allowed illegal immigrants to receive benefits. They stopped verifying eligibility, so there are, according to the Congressional Budget Office, millions of people on Medicaid that don't qualify. That's why it's going bankrupt. And those of us on this side of the aisle want to make sure that doesn't happen because of Deborah
Medicaid isn't going bankrupt
and Vicki
in the same way
and
Social
Melissa
Security
and
is
all
not going
the people in my
bankrupt.
district who depend on Medicaid.
Anything they don't like.
And I'm sorry
from
that
the Postal Service.
you've
that
been
They want to smear. They claim it's going bankrupt.
victims of deception and fiction and falsifications. They've scared you into thinking that somehow something's going to be taken away from you. But that's just not true. And I'm really disappointed that some of my colleagues have made personal attacks. I mean, we've sat here for 20 hours and been told we don't like children, we don't like disabled children, we don't like old people. I mean, we've been told that we want to hurt people intentionally. I mean, it's unbelievable, the fiction and the falsity and the half-truths and exaggerations that we've had to sit through. And really, we're better than that. Because this committee has a long history of working together and solving problems, and we can solve this problem too. And you've got my commitment. You've got everybody on this side of the aisle's commitment. We're going to continue to fight for you. We're going to continue to make sure that Medicaid is there, that it works for you. We're going to make it better. We're going to try to add resources to it. We're committed. We're in. And this piece of legislation is a good first step. There's a lot more work to do. And I just say to my colleagues, Mr. Chairman, on the other side of the aisle, I would extend my hand to them. Let's work together. Let's stop calling names. Let's stop pointing fingers. Because the folks who are here in this room, who've been here for 20 hours, the folks watching us at home that are scared to death because of the pretense and the myths and the fables and the yarns and the stories they've been told, they're not true. The only threat to you and your Medicaid are illegal immigrants and people that don't qualify that are taking the benefits, that are getting in line ahead of you, that are booking the appointment.
I don't know what to tell you if you believe this. If you believe more of this hateful rhetoric, the reason why Medicaid is in danger is undocumented immigrants, I don't know what to tell you. I really don't.
I urge my colleagues to support the legislation, and with that, I yield back.
Gentleman yields back. The chair will recognize the gentlelady from Colorado for
Well,
5 minutes to speak on the.
Thank you, Mr. Chairman. I really hadn't intended to say anything, but this is kind of crazy because my friends on the other side of the aisle are talking about all these people who are on Medicaid, and let's be clear, everyone in this room wants those people to be on Medicaid. If they're eligible for Medicaid, of course, they deserve to be on Medicaid. And as we've said numerous times, there are no undocumented people that are covered by federal funds for Medicaid. So all those people, my friends on the other side of the aisle, are talking about they're not going to lose their Medicaid to people who are undocumented. It is not an either-or proposition. That's number one. But number two, it's hard for me to explain how the Nonpartisan Congressional Budget Office says 13.7 million people are going to lose their health insurance because of the various nibbling cuts that the majority makes in the bill, and also because they stopped the ACA expansion. So those 13.5 million people are people who are on Medicaid right now who then will be thrown off. So they're not going to be kept on Medicaid at the expense of those other people that my colleagues mentioned. All of them.
Well, Gentlelady, yield.
No, I won't. All of them can have the health care that they need, and in fact, several of my colleagues mentioned uninsured people fell dramatically when we did the ACA expansion, which is good for the health care of those people, and also it's cost effective. So why are we here? Why are we doing this? And I'm going to be honest, we're not doing this because Medicaid's about to become insolvent. We're doing this in order to give a tax cut to billionaires and corporations. And this bill, which takes 13.7 million people off of Medicaid, is going to allow the Republicans to get over $700 billion in credits. That's how they're going to be able to pay for the tax cuts. So it's not like some big crisis and we're going to throw elderly people and disabled people off. It's that we're going to throw people who are eligible for Medicaid off in order to give the tax cuts. And let's be real clear about this, because this is millions of people. These are my constituents' lives. These are your constituents' lives. And P.S., I just have to point out, if you actually manage to zero out Planned Parenthood, that's 1 million Americans, women, who are getting their health care, their women health care through Planned Parenthood. They're going to go off too. I yield back.
Gentlelady yields back, and the chair recognizes the gentleman from Georgia, Mr. Allen.
Thank you, Mr. Chairman. I yield Mr. Hudson my time.
Thank the gentleman. I was just going to ask the gentlelady, she was citing a CBO number, and I just wanted to ask if she was aware that one of the subsets, one of the groups that she was citing is 1.6 million of those are, according to the Congressional Budget Office, the source that the gentlelady was citing, are illegal immigrants. I mean, in fact, I could enter for the record, Mr. Chairman, without objection.
Without objection, so ordered.
I don't have any, I yielded my time back.
So I think we agree with the source.
You know what, if I can reclaim my time.
We all need to agree with facts.
Well,
But
if I can reclaim my
it's
time.
actually Mr. Allen's time.
We're on Mr. Allen's time. You've yielded back.
These facts are tough. No, I just think that's a good example of why this is so confusing. She was citing the Congressional Budget Office number, and a subset of that number is that she cites will lose their coverage. That's right, 1.4 million illegal immigrants are right now on Medicaid, according to the Congressional Budget Office, nonpartisan, not my source, her source. So, Mr. Chairman, with that, I'll yield back to Mr. Allen.
Will the gentleman yield to me
It's
then?
the gentleman from Georgia's time.
Yes, I know. Will the gentleman yield to me?
I yield back.
He yield back. So now anyone on the Democrat side seek recognition. The gentlelady from Washington is recognized for 5 minutes to speak on the amendment.
Thank you, Mr. Chairman. I'd like to summarize my concerns with this bill by telling the story of a constituent of mine. Miguel is a 76-year-old widower who lives in Wenatchee, a small city in my district in central Washington, and it's also the apple capital of the world. So if you eat Washington apples, there's a good chance they come from my district. Now, after Miguel's wife passed away, he relied solely on his Social Security check to cover his living expenses. A retired orchard worker, Miguel spent decades doing physically demanding labor without access to a pension, and private insurance was never affordable. He depends on Medicaid to stay in his modest home, receiving regular in-home nursing visits and help with daily tasks like bathing and cooking, managing his medications. And without Medicaid's coverage for home-based care and transportation and care coordination, he would have no way to attend his checkups or manage his diabetes and the limitations caused by a stroke. Miguel fears losing access to the services that allow him to live with dignity and independence in his own home. For seniors like Miguel, Medicaid's not optional. It's their lifeline. And unfortunately, Miguel's fears are not unfounded. The rural hospital he depends on treats patients that are more likely to be on Medicaid just like he is. If those patients lose their health insurance because of this bill, the cost of their care gets absorbed by the hospital. And for already struggling rural hospitals that face additional barriers when providing care, this will force them to cut services or close altogether, leaving patients like Miguel without access to care. I am not trying to fearmonger or deceive Americans. I am simply telling you what our rural hospitals and our community health centers are telling me. The bill will take away health care from 13.7 million Americans, all while increasing costs for everyone and decreasing access to care. I want you to think about that. Finally, I'd like to thank all of the advocates who came to Washington, D.C. to attend this hearing because their futures also depend on Medicaid. I will tell you that I have been paying attention to the people packing this committee room, including all night long while we were here, those filling the halls of this building, those who were lined up outside waiting to get in. I looked at those t-shirts, I looked at those signs, and let me tell you, not a single one said, gut Medicaid, tax cuts for billionaires. The public has spoken. My colleagues' constituents have spoken, and now my Republican colleagues have a very important decision to make. And I sure hope that they decide to answer to their constituents and not to the president, and that they choose to protect Medicaid. Thank you, and I yield back.
Gentlelady yields back. There any on the Republican side? Seeing none, the gentlelady from Texas, Ms. Fletcher, is recognized for 5 minutes to speak on the amendment.
Well, thank you so much, Mr. Chairman. And as we wrap up here, I join the others in thanking you for how you have conducted this markup and for answering or trying to answer my many questions, as well as thank Ranking Member Pallone and, of course, the fantastic staff here and all the advocates who've joined us over the last 25, almost 26 hours now and long before to help inform and help us make smart policy. And I support this amendment, and I think it's important that this bill cannot take effect if its provisions result in reduced access to health care coverage, and that is what we have been talking about for the last 25 hours. Throughout this markup, we have talked about big issues and all the ways we know it's true that the things we've talked about over the last day are the likely outcomes of the legislation that we're marking up. We've been here a long time. I know we've said a lot of things over and over, but I hope that repetition has registered because we have been here before. So many of the things that Republicans are proposing to do in this bill, states have tried them and they have failed. We heard cautionary tales from Arkansas and Georgia as Dr. Ruiz recapped, and we've heard cautionary tales from Texas. As I discussed earlier, defunding Planned Parenthood has failed by every metric, and it continues to fail Texas women. And in Texas, we saw recently the redeterminations after the moratorium on Medicaid disenrollments at the end of the COVID pandemic is also a cautionary tale. Texas didn't allow for automatic renewals, forced almost all the beneficiaries to resubmit their documents to prove that they were eligible, the kinds of things we're talking about in this bill, and almost 1.4 million people lost coverage for procedural reasons, like what we're talking about here, failing to submit a form or making an error. It was not because they were not eligible for coverage. Nearly 1 million, just shy of 1 million of those people were children. And we have another cautionary tale from Texas, and I think it's important to know. In 2003, In order to reduce the enrollment and cost of CHIP, the Republican Texas legislature passed a bill requiring twice-a-year enrollment, much like the one proposed in this bill. And while proposed as ensuring eligibility, it was an absolute disaster of the state losing paperwork, and it became a tragedy for families. A friend was just telling me about a Houston child, Devontae Johnson, who had a treatable form of cancer back in 2007. Devontae's mom was a paralegal, and she was so diligent about getting all of his forms in on time. She knew his cancer treatment required CHIP coverage, and she did everything right. The state of Texas lost his paperwork. And when she couldn't get help, she finally turned to our former colleague here, Congressman Sylvester Turner. And he was able to help Texas Children's Hospital resume Devontae's treatment immediately. But because of the pause in his treatment, when he lost his coverage because the state lost his paperwork, his tumors returned and they grew. Representative Turner passed HB 107 in the Texas legislature in 2007, and that eliminated this twice-a-year requirement. And I just want to point out, this policy was so bad that the state of Texas repealed it. It made an immediate difference in enrollment, but it was too late for Devontae. He died before the bill became law. Let this lesson be a story now, before it is too late, before you vote to increase the frequency of eligibility verifications. Let's not make the law that was so bad in Texas become the law of the land across the country. Let's listen to each other, and even if we aren't persuading each other right now, let's listen to the doctors and the people who are telling us what this means in real life. Let's be smarter. Let's learn from these failed experiments in the states, failures that the CBO considered when it reached its conclusions about this bill, failures that we should consider here before it is too late, before nearly 14 million Americans lose their health care. It's not too late. It is not too late to do the right thing by and for the American people. Thank you, Mr. Chairman. I yield back.
Thank you. The gentlelady yields back. Anyone on the Republican side? Seeing none. Next on the Democrat side will be Ms. Kelly from Illinois. You gentlelady is recognized for 5 minutes.
Thank you, Mr. Chair. I'd like to yield my minutes to Representative DeGette.
I thank the gentlelady for yielding, and I think this is an important issue to discuss because it's the main thing in the talking points of the Republicans. My colleague from North Carolina says facts are tough, and he is correct. Facts are tough if you actually see what this bill does for undocumented individuals. If you look at the CBO score, which I have in my hand right here, you might want to follow along. The federal government, as I have said repeatedly, and as I put the statute into the record last night, does not cover undocumented people under Medicaid. Some states do choose to do it. And the reason some states do it is because the undocumented people will flood their emergency rooms and cause their state costs to go up so dramatically. So what the Republican bill does, if you read along, it says reducing expansion FMAP for certain states providing payments for health care furnished to certain individuals. So it's not cutting Medicaid benefits to undocumented people, it's cutting FMAP benefits to states, which could go to those very same people my Republican colleagues are talking about. People who are elderly, people who are disabled, other people who are eligible for Medicaid because the state's FMAP is going to be reduced for Medicaid. But even more crazy about this argument that they're making, even if you accept, oh, Medicaid's going to go for undocumented people, do you know how much this saves? Do you know how much this saves? $11 billion. And it's $11 billion taken out of the money that goes to the state. So I guess the question I have, actually, I'm going to ask it as a rhetorical question, is because this bill says it saves over $700 billion. So if only $11 billion of that is for people who are undocumented, where else are you going to cut that other $700 billion? You're going to cut it from the 13.7 million Americans who are eligible for Medicaid, who you're going to push right off. I yield back. And I thank the gentlelady for yielding.
Gentlelady's time from Illinois. Do you yield back? Gentlelady from Illinois yields back. The gentleman from New Jersey is recognized for 5 minutes to speak on the amendment.
Thank you, Chairman. I just want to thank you. I've had an immense amount of respect for you before this hearing, this markup, I should say, and I think you did an incredible job navigating the committee through it on a really difficult bill. A lot of different opinions about it, but I thought you treated both sides extremely fairly, so I want to thank you for that. The ranking member knows how I feel about him, but thank you, Frank, as always, and to the staff who did an incredible job sticking with us. I know for everyone's personal office, there was a lot of time spent here. And listen, we've been here for 25 hours. I know people are still making points that we've made over the last 25 hours. I'm not going to. You know there's things I disagree with and feel differently about. The point I would make, though, is that there are so many things in this bill that I think under different circumstances, the committee would have really enjoyed working together on a bipartisan basis on. I really believe that. From artificial intelligence, cybersecurity, I think energy and healthcare, there's things that we actually want to do. I think the environment that we had to do it through reconciliation, through a tight time frame, create a difficult set of circumstances to do so. But I think we just have to get out of the habit of trying, and I think both sides are responsible for this, but we have big challenges as a country. People that I talk to back home in my very democratic district know what I say is that to solve the challenges of our day, they won't be solved by Democrats alone or Republicans alone. They'll be solved when we realize these are American challenges. And I think the things that we discussed in this bill are things that we need to work on a bipartisan basis. Frankly, I don't know how we get there in the near term, but I just want people to know that I think a lot of us are committed to working on things in a bipartisan way. We have to figure out how we can do that, because like I said, this is a challenging environment to do so. We need to figure out ways to build back trust. This is a bipartisan committee that deals with the broadest jurisdiction of any committee. That's why so many of us wanted to be on it. And I just hope that we can figure out a way to get back there, because there's a lot of work we have to do for the American people. Our challenges aren't getting any easier. They're only getting increasingly more challenging, more difficult. Our foreign adversaries are getting more sophisticated, so that really requires that we come together. And I just hope that we can do that and start showing some good faith on both sides, so we can take these challenges on together. With that, I yield back.
Thank you. I thank my friend from New Jersey for his kind words, and we will find opportunities to work together. I know people kind of move around a little bit. Just remember, we have 3 roll call votes, and we're getting close to them, so stay close. Mr. Obernolte from California is recognized for 5 minutes to speak on the amendment.
Well, thank you, Mr. Chairman. I'd like to join my colleagues in thanking you and all of the committee staff for your hard work over the last 26 hours almost of this hearing. It's been a unique experience to sit through, and to be honest with you, I'm kind of vacillating between, on the one hand, being encouraged because this is really an exercise in democracy. You've heard passionate debate on a topic that's important to everyone in this room for the last 26 hours. But on the other hand, I have to be honest, I found it to be also a deeply cynical, performative, partisan experience. So I'll have to reflect on that some more after I've gotten some sleep. I'll tell you one thing, though, that has really struck me, and that's the things that everyone on this dais agrees with. Medicaid is something we all care very deeply about. And I think we all recognize the purpose for which Medicaid was created, to serve the core population of the least fortunate people that need that social safety net in society, the disabled, pregnant women, children, the poor. And we are all passionately committed to making sure that that core program is around for a future generation of Americans. But there's something else that should also be abundantly clear to everyone in this room, which is that Medicaid is on a fiscally unsustainable trajectory. It is the single largest, fastest growing expenditure in federal government. And this is a federal government that this year will run a deficit of over $2 trillion. That's 30% of all federal spending. And that's what's driven our federal debt to over $37 trillion. And folks, if you think that that is sustainable, you need to read some of the literature that our bipartisan Congressional Budget Office is putting out, or you need to come attend some of our Congressional Budget Committee hearings, because we are running out of our capacity to continue to borrow. Ultimately, our ability to borrow is governed by the willingness of people to lend us that money, and those rates are going up, and we will not be able to continue to do this. So continuing down this path of providing Medicaid to the people who need it will require some changes to the program. And this bill, the one we've been debating for the last 26 hours, proposes some relatively modest changes. What do I mean by modest? Overall, the whole reconciliation package, when it's put together, will encompass about 2% of overall federal spending, 2%. The Medicaid portion that we've been debating, depending on how you figure it, is in the single digits of percentage of overall Medicaid spending. And in fact, even if the bill is put into law exactly as it was in print today, overall federal spending on Medicaid will continue to increase, not decrease. So it's not a cut, it's just bending the curve a little bit. But I'm also a little bit disturbed by the things we haven't been able to agree on. For example, what is wrong with asking the states to check the death rolls to make sure that we're not spending taxpayer money on someone who is deceased? We should all be able to agree on that. What's wrong with asking the states to compare notes with each other, so when we have a beneficiary who moves from one state to another, which according to the Inspector General happens quite often, that we aren't continuing to pay health insurance premiums in 2 different states for the same person? We should all be able to agree on that. And then this debate about community engagement. And I know the folks on the other side of this issue are calling them work requirements. Just to remind everyone, read the bill. We're talking about half-time. 20 hours a week is the requirement. Not just work and satisfied. You can go to school, you can volunteer in your community. It's only for the expansion population, which means people who are not poor, not disabled, the able-bodied, people who don't have dependents, who don't have a substance abuse disorder, who aren't enrolled in a substance abuse program. And I have to say, I heard a couple of my colleagues on the other side of the aisle say that we're doing this because we're cruel and we don't care. And I find that offensive. We are all here because we deeply care. But the expansion population was supposed to be part of our social safety net. It's not something that was intended for people to be on their whole lives. And the reason why we do this is because we want to help people get off of Medicaid and back on their feet. We want them on the exchanges in traditional health insurance. We're not doing this because we don't care. I want that for my constituents because I care about them. And this is necessary to preserve the future of this program for the people that are depending on it, the core population. And if we don't make these changes, this program won't be around for future generations of Americans. So I urge a rejection of the amendment, and I urge adoption of the underlying aims. I yield back.
The gentleman yields back. The gentleman from Texas, Mr. Veazey, is recognized for 5 minutes to speak on the amendment.
Thank you, Mr. Chairman. I'll be brief because I know that this has been a very, very long day. I was thinking about the different constituencies that will be hurt by these cuts to Medicaid. And of course, the constituency that I represent is a largely Latino and African-American community in Fort Worth and Dallas and some of the surrounding cities. But that's not all who's going to be hurt. And there was a really good article that I encourage everyone to go and read that was in the Washington Post, and it was direct quotes, so no one can say liberal media or anything like that. These are quotes that come directly from these people that were affected, and it was in a place called Newcastle, Pennsylvania. And these were mainly Italian Americans that had been Democrats a generation before, but they were proud Trump voters, and they were all on SNAP and Medicaid, and they were convinced that that Trump would never take their Medicaid away from them. And so I was thinking about them, and it reminded me there was a notable death that happened in Republican politics back in 2023. Kevin Phillips, some of you probably know that name that have studied political history, but he wrote a book called The Emerging Republican Majority, and he was Nixon's 68-gallon race. And he had a quote, and it was, "The whole secret of politics is knowing who hates who." And what I'm asking my Republican colleagues and friends is, when the people in Newcastle, Pennsylvania are upset that they lose their Medicaid, please don't pit them against the undocumented population. And I'm just calling it now because I don't want you to do that. Because if I don't call it now, people will pretend like it's new, and they'll try to say, well, see, people in Newcastle, Pennsylvania, you lost your Medicaid because of these people that are undocumented. So we know the game. It goes back to all the way back when Kevin Phillips wrote this book. So we know the game. We know how the game is played. But I think that we need to figure out a way how to get beyond that in this country. So please don't use that card when people in places like Newcastle, Pennsylvania lose their Medicaid. Mr. Chairman, I yield back.
Gentleman yields back. Is there any member on the Republican side? Seeing none. The gentleman from Ohio, Mr. Landsman, is recognized for 5 minutes to speak on the amendment.
Thank you, Mr. Chairman. I support the amendment. I don't believe that anyone should lose their health care. That's what the amendment says. No one should lose their health care. It's a core belief of mine. I think people should get more health care. We should expand health care. We shouldn't cut health care. I don't believe that there's people who deserve health care, deserve to be on Medicaid, and people who don't. I think everyone deserves health care. And I genuinely believe that's something that we share despite the outcome today. I think the only reason we're here and the majority is cutting $715 billion from Medicaid is because that was the assignment. It was a math assignment. The assignment was to find $880 billion to cut in order to pay for tax cuts that overwhelmingly benefit the wealthy and big corporations. And here's the math. At the end of the day, right, multiple hearings, $715 billion in Medicaid cuts, healthcare cuts. That's 8.6 million people who will lose healthcare. $358 billion in ACA cuts. That's 5.1 million people who will lose healthcare. $230 billion in food assistance cuts. That's millions of people that are going to lose food assistance. If you add it up, 715, 358, 230, that's $1.3 trillion. Now hold that number, $1.3 trillion. Because again, this is a math assignment. If we decided that we were going to work together, put workers over wealth, we would take up the corporate tax rate. We would say, look, a few years ago, it was 35%. And then it got cut to 21%. If you take it to 28%, not even anywhere near 35% where it was several years ago, that would generate $1.3 trillion. So you just change the corporate tax rate a little bit, and everybody keeps their health care, everybody keeps their food assistance, and everybody gets their tax cut. Everyone wins.
There it is.
No one should lose their health care or food assistance, and everyone that needs tax relief should get it. Let's go a little further. Just play this out. There are two major changes to the tax code that if we were all working together, I think we could make some headway on. One is the top wage earners. Before this tax cut, the top earners in this country were taxed at a rate of 39.6%. It got cut to 37%. If you let that expire, that's $246 billion. If you add the billionaire minimum income tax, call it the Elon tax, they have to pay a minimum tax, that's $503 billion. You add that together, that's $749 billion. That would allow us to spend $325 billion, which pays for comprehensive paid family medical leave, $200 billion for free universal preschool, $135 billion to restore the earned income tax credit that help people pay all their bills, and free community college, which is $90 billion. You add all of those things up, it equals exactly $749 billion. And so I think if we had a different assignment, we would come to a better budget. And my hope is, in the end, you all won't have the votes. I genuinely hope that. And then you'll need us. And then we will work together in a bipartisan way. We will get a budget that provides tax relief for workers, tax relief for the middle class, tax relief for farmers, tax relief for small businesses. And it invests in our workers, fixes the tax code so everyone at the top pays all their taxes. That's what I believe will happen if you all don't have the votes. We will work together, and hopefully we'll be back here, and no one will lose their health care, no one will lose their food assistance, and everyone will get the tax relief they need. With that, I yield back.
Gentleman yields back. Is there anyone else seeking discussion? The gentleman from Idaho, Mr. Fulcher.
Thank you, Mr. Chairman. I don't pretend to have the verbiage to say anything better than it's been already said, or clear, or convince anyone any differently. But I just, at the end of this whole proposition, I just felt like it was important to say something. And what is dawned upon me these last 20 plus hours is that if you say something often enough, you have a tendency to believe it. It doesn't have to be true, but if you say it often enough, you have a tendency to believe it. And we've heard over and over and over again that this is tax cuts to billionaires. And I truly believe that my colleagues on the other side of the aisle believe that. We hear over and over and over again that we're cutting benefits, when the reality is this is a work requirement, and that's fair for working age able-bodied people. That's fair. That saves it for the people it's intended for. It's validation of eligibility. That's what it is. It's not cutting the benefits. It's making the program solvent. Red tape concerns was one of the biggest ones for me, because it's coming from my friends on the other side of the aisle who've never seen a reg or a rule they don't like. It's really about accountability and transparency. If you say things often enough, you have a tendency to believe it. This is not hurting the targeted Medicaid population. This is saving the system so they can get it. Mr. Chairman, add my name to the list of the people who said you did a pretty darn good job given the whole circumstances on this whole thing. We're going to wrap this up. We're going to make this happen. I encourage support of the Ains. I yield back.
Thank you, and we hope to do it before the next round of votes. We don't want to come back tonight, that's for sure. So the gentlelady from Virginia is recognized for 5 minutes to speak on the amendment.
Thank you, Mr. Chair. I believe that many of us in this room, if not all, do want to protect the most vulnerable and deserving of health care coverage. But there doesn't seem to be a lot of agreement on exactly who that is. And that's especially true for the larger Republican caucus, because there are people outside of this room who don't even like this because they think it doesn't cut enough people. Based on everything that I have heard in the past 25 hours, there seems to me to be a disdain among some of you for the expansion population. I've heard some, like the chairman, say they're deserving and need to be included. I've heard others that say we need to get back to the original population, which I assume means 1965. But I'm going to give you the benefit of the doubt as a preacher's kid and say, you mean the expansion population. I hear a clear disdain for undocumented immigrants and transgender individuals who have become the boogeyman for the vast majority of Republicans for everything that they think ails this country. But whether we like it or not,
they're not the ones that are causing the increases in the Medicaid costs. And they do get sick, and they get injured. And if they get sick enough or injured enough, they're going to show up in the emergency room, and they're going to get treated under federal law. And if they're not insured, the cost of their care is going to be passed on to everybody else, and our health costs will go up. Now, as I've mentioned several times today, the real underlying reason for the vast majority of the increase in costs of Medicaid and healthcare in general are the fact that people are living longer with more complex underlying conditions, and that individuals with chronic conditions and disabilities that have that complex care, those costs are ballooning. And this bill does very little, if anything, to address that. It does very little to address the healthcare workforce shortages that we've talked about, the increase in prescription drug prices and technology costs, and the other things that make it difficult to provide care. It does nothing to address the underlying causes of the maternal and infant mortality crisis, the substance abuse crisis, that making serving those populations challenging, even as the actions of the Trump administration gut the very workforce and programs designed to help address those crises and those problems. This bill does nothing to address the gutting of our public health care workforce and infrastructure or tariffs that increase costs, including health care costs. This bill ignores the environmental and social determinants of health and actively works to roll back problems designed to address them as woke or whatever. It makes assumptions that somebody who earns $300 a week will pay up to $35 because they need to get skin in the game, and ignores the reality that that person also has to pay rent, groceries, transportation costs to get to and from the job that they need to have. And they're going to end up not paying $35 to get primary or preventative care, but they will eventually show up in the emergency room. Democrats have been cut out of this process from day one and then asked to trust that this big, beautiful bill that we had nothing to do with, that we got a framework on Sunday for and the text on Monday, and that we're supposed to trust that it doesn't make mistakes by adopting work requirements that have been shown to not actually work in the states that have done them. Oh, trust us. Trust the same people who sit back as Elon Musk fires people by accident and says, oops, mistakes were made, and laughs about it. Everybody in this room, our view on this bill and healthcare policy is based on our life experiences and what we know. And it's very different, and very different from the vast majority of the people that we represent. So I believe healthcare is a right. Because in the Declaration of Independence, the first word of the rights that we're endowed by our Creator with is life. And you need health care to live. I also believe that lowering the number of uninsured lowers the cost for everybody. I think that's what the American people want. I think that's why they've consistently said don't repeal the Affordable Care Act or gut Medicaid or Social Security. I think this bill is going to do all of that, and it's not finished. And that's why you hear us reflecting the fears of our constituents. Listen to them, and I yield back.
Thank you. Are there any others seeking recognition? The gentleman from Georgia seeks recognition to speak on the amendment.
Thank you, Mr. Chairman. And again, as everyone has indicated, you did a great job. Folks, this may come as a surprise to some of my colleagues, but I'm a pharmacist. Anybody know that? No, seriously, I am. I was
Weber
a pharmacist.
just asked, what drug are you taking? That's
Yeah. I may not be taking drugs, and I don't, but I will tell you, I sold a bunch of them. See, I had 3 pharmacies that I owned, and those pharmacies served Medicaid patients. And I had another business that I owned, and that business serviced nursing homes and personal care homes and assisted livings and hospices. In fact, when I sold that business, it was the second largest provider of institutional pharmacy in the state of Georgia. I was very proud of that. But I tell you that because I've seen it firsthand. I know how important this program is. I know how people depend on it. I was the one at the front of the counter when the senior citizens were up there with their Medicaid card, trying to get their medication. I was the one doing that. I was the one in the nursing home, sitting behind the nurse's station, going through patients' charts, trying to decide what to recommend for those patients and their drug therapy, what was covered and what wasn't covered, and how could we do the best we could for them. And I knew there were a lot of problems. I knew there were some people on there that shouldn't be on there. And if you look at what we've done, and this is why I'm so proud of this, because what we've done, we're going to stop paying for people that aren't actually eligible. This is for the most vulnerable in our society. We don't need those who are not supposed to be on it, on this program. We need the people. We got a waiting list for some people. They need to be on this program. Yet there are people who shouldn't be on the program, who are on it, and they don't need to be on it. That's what we're doing. We're cleaning that up. We're making sure that we're not going to pay for 1.6 million people who are getting it in more than one state. They get it in 2 states. Some of them get it in 3 states. That's waste. That's not what we need to be doing. We shouldn't be giving it to illegals. They should not. This is for the American people. We shouldn't be giving. Now, we need to, I agree, yeah, we need to address that. But this program was intended for the most vulnerable in our society.
If Medicaid portability were a real thing, I imagine, I'm pretty certain, as an expert, many fewer people would be enrolled in more than one state's plan.
Look, there's some bad actors out there.
Disabled Americans.
Every profession has bad actors. There's some bad pharmacists out there who are billing that shouldn't be billing. Some bad physicians who are billing that shouldn't be billing. That's the kind of thing we're going after here. That's what we're cleaning up. And then we talk about the community involvement. Yes, if you're able-bodied, you ought to be working. You ought to be volunteering. Now, if you're taking care of a child, if you're taking care of a parent, no, that's not what it says. What it says is if you're an adult, able-bodied, if you're above 19 years of age, older than that, or under 64, yes, you ought to be volunteering. You ought to be doing something. And what's wrong with that? I saw people on that program when I was practicing that it shouldn't be on it. But I saw those people who needed it so bad. Folks, I grew up in South Georgia. We got a lot of paper mills in South Georgia. I worked in a paper mill. My daddy worked 33 and a half years shift work in a paper mill. I don't know if any of you have ever worked in a paper mill, but I worked on a broke beater. And it's not hell, but you can see hell from there, I'll tell you that. It's hard. And those people work hard. And we need to be taking care of them. And what we're doing with this is we're cleaning up this program. We're not kicking anybody off. What we're doing is making it better. I'm very proud of this.
Medicaid and the people who rely on it are not dirty. Do not need to be cleaned up.
This is going to make Medicaid better. And I yield.
The gentleman yields back. If there's no further discussion, the vote occurs on the amendment. The gentleman requests a recorded vote, and there will be 3 successive recorded votes. So if everybody could stay close by, we will appreciate expediting that. So the gentleman requests a recorded vote, and the clerk will call the roll.
Mr. Latta.
This is on the amendment.
Mr. Latta votes no. Mr. Griffith. Mr. Griffith votes no. Mr. Bilirakis. Mr. Bilirakis votes no. Mr. Hudson. Mr. Hudson votes no. Mr. Carter of Georgia. Mr. Carter of Georgia votes no. Mr. Palmer. Mr. Palmer votes no. Mr. Dunn. Mr. Dunn votes no. Mr. Crenshaw. Mr. Joyce. Mr. Joyce votes no. Mr. Weber. Mr. Weber votes no. Mr. Allen. Mr. Allen votes no. Mr. Balderson. Mr. Balderson votes no. Mr. Fulcher. Mr. Pfluger. Mrs. Harshbarger. Mrs. Miller Meeks. Mrs. Miller Meeks votes no. Mrs. Kamick. Mr. Obernolte. Mr. Obernolte votes no. Mr. James. Mr. Benz. Mr. Benz votes no. Mrs. Houchin. Mrs. Houchin votes no. Mr. Fry. Mr. Fry votes no. Ms. Lee. Ms. Lee votes no. Mr. Langworthy. Mr. Langworthy votes no. Mr. Kane. Mr. Kane votes no. Mr. Rulli. Mr. Rulli votes no. Mr. Evans. Mr. Evans votes no. Mr. Goldman. Mr. Goldman. Mr. Goldman. Mr. Goldman votes no. Mrs. Fedorchak. Mrs. Fedorchak votes no. Mr. Pallone. Mr. Pallone votes aye. Mr. Gatt. Mr. Gatt votes aye. Ms. Schakowsky. Ms. Schakowsky votes aye. Ms. Matsui. Ms. Matsui votes aye. Ms. Castor. Ms. Castor votes aye. Mr. Tonko.
Aye.
Mr. Tonko votes aye. Ms. Clark. Ms. Clark votes aye. Mr. Ruiz. Mr. Ruiz votes aye. Mr. Peters. Mr. Peters votes aye. Mrs. Dingle. Mrs. Dingle votes aye. Mr. Veazey. Mr. Veazey votes aye. Ms. Kelly. Ms. Kelly votes aye. Ms. Bardagan. Ms. Bardagan votes aye. Mr. Soto. Mr. Soto votes aye. Ms. Schreier. Ms. Schreier votes aye. Ms. Trahan. Ms. Trahan votes aye. Ms. Fletcher. Ms. Fletcher votes aye. Ms. Ocasio-Cortez. Mr. Auchincloss. Ms. Ocasio-Cortez votes aye. Mr. Auchincloss. Mr. Auchincloss votes aye. Mr. Carter of Louisiana. Mr. Carter of Louisiana votes aye. Mr. Menendez. Mr. Menendez votes aye. Mr. Mullen. Mr. Mullen. Mr. Mullen votes aye. Mr. Landsman. Mr. Landsman votes aye. Ms. McCullen. Ms. McCullen votes aye. Mr. Guthrie.
So I'm no. No
Chairman
on the
Guthrie
amendment.
votes no.
So we have Ms. Harshbarger,
Mrs. Harshbarger is not recorded.
Mr. Fulker.
Mrs. Harshbarger votes
Fulcher?
no.
Mr. Fulcher.
Mr. Fulcher votes no.
Mr. James.
No. Mr. James is not recorded.
You said
James, no.
Ms.
Mr. James
Kamick.
votes no. Mrs. Kamick is not recorded. Mrs. Kamick votes
Mr.
no.
Crenshaw.
Crenshaw's no.
Mr. Crenshaw votes no.
All right, everybody can stay put. We'll get through that. We have Ms. Alexandria
Mr. Chairman, Mr.
Ocasio-Cortez, I'm
Pfluger.
sorry. I'm sorry, Ms. Ocasio-Cortez, you,
Ms. Ocasio-Cortez is recorded as aye.
okay.
Mr. Chairman, Mr. Pfluger is not recorded.
Who's not recorded?
Mr. Pfluger.
Mr. Pfluger, oh, okay, Pfluger.
Mr. Pfluger votes no.
Is everybody recorded that wants to be recorded? So again, everybody stay put. We'll get through this pretty quick. So the clerk will report.
Mr. Chairman, on that vote, there were 24 ayes and 30 noes.
So the amendment is not agreed to. So now we're going to do the amendment in the nature of a substitute. No, okay. Okay, which we're going to do by voice. So everybody, so if there is no further discussion, the vote occurs on the amendment in the nature of a substitute. All those in favor shall signify by saying aye. Aye. All those opposed, no? No. In the opinion of the chair, the ayes have it. The amendment in the nature of substitute is agreed to. Are there further amendments? Seeing none, so this will be a roll call vote. I move that the committee do now approve and agree to transmit to the House Committee on the Budget. No, subtitle Okay, I'm sorry, let me start over. I move that the committee do now approve and agree to transmit to the House Committee on Budget, Subtitle D, Budget Reconciliation Legislation Recommendation as amended to Health. Okay, so we got a roll call this one and one more roll call on this. So a roll call has been requested and the clerk will call the roll.
Mr. Latta. Mr. Latta votes aye. Mr. Griffith. Mr. Griffith votes aye. Mr. Bilirakis. Mr. Bilirakis votes aye. Mr. Hudson. Mr. Hudson votes aye. Mr. Carter of Georgia. Mr. Carter of Georgia votes aye. Mr. Palmer. Mr. Palmer votes aye. Mr. Dunn. Mr. Dunn votes aye. Mr. Crenshaw. Mr. Crenshaw votes aye. Mr. Joyce. Mr. Joyce votes aye. Mr. Weber. Mr. Weber votes aye. Mr. Allen. Mr. Allen votes aye. Mr. Balderson. Mr. Balderson votes aye. Mr. Fulcher. Mr. Fulcher votes aye. Mr. Pfluger. Mr. Pfluger votes aye. Mrs. Harshbarger. Mrs. Harshbarger. Mrs. Harshbarger votes aye. Mrs. Miller Meeks. Mrs. Miller Meeks votes aye. Mrs. Kamick. Mrs. Kamick votes aye. Mr. Obernolte. Mr. Obernolte votes aye. Mr. James. Mr. James votes aye. Mr. Bentz. Mr. Bentz votes aye. Mrs. Houchin. Mrs. Houchin votes aye. Mr. Fry. Mr. Fry votes aye. Ms. Lee. Ms. Lee votes aye. Mr. Langworthy. Mr. Langworthy votes aye. Mr. Kane. Mr. Kane votes aye. Mr. Rulli. Mr. Rulli votes aye. Mr. Evans. Mr. Evans votes aye. Mr. Goldman. Mr. Goldman votes aye. Mrs. Fedorchak. Mrs. Fedorchak votes aye. Mr. Pallone. Mr. Pallone votes no. Mr. Gatt. Mr. Gatt votes no. Ms. Schakowsky. Ms. Schakowsky votes no. Ms. Matsui. Ms. Matsui votes no. Ms. Castor. Ms. Castor votes no. Mr. Tonko.
No.
Mr. Tonko votes no. Ms. Clark. Ms. Clark votes no. Mr. Ruiz. Mr. Ruiz votes no. Mr. Peters. Mr. Peters votes no. Mrs. Dingle. Mrs. Dingle votes no. Mr. Veazey. Mr. Veazey votes no. Ms. Kelly. Ms. Kelly votes no. Ms. Badigan. Ms. Badigan votes no. Mr. Soto. Mr. Soto votes no. Ms. Schreier. Ms. Schreier votes no. Ms. Trahan. Ms. Trahan votes no. Ms. Fletcher. Ms. Fletcher votes no. Ms. Ocasio-Cortez. Ms. Ocasio-Cortez votes no. Mr. Auchincloss. Mr. Auchincloss votes no. Mr. Carter of Louisiana. Mr. Carter of Louisiana votes no. Mr. Menendez. Mr. Menendez votes no. Mr. Mullen. Mr. Mullen votes no. Mr. Landsman. Mr. Landsman.
He's a no.
Mr. Landsman votes no. Mr. McCollum. Mr. McCollum votes no. Chairman Guthrie.
Aye.
Chairman Guthrie votes aye.
Is anyone not responding to the roll call? Anybody not responded to the roll call? Seeing none, the clerk will report.
Chairman Guthrie, on that vote, there were 30 ayes and 24 noes.
The ayes have it and the motion is agreed to. So we have one final roll call vote. Before we close, I just would like to take a moment to say thank you to Phil Swagel, the director of the CBO, along with his team and analysts that we went through quite often. I would like to offer special thanks to Warren Burke, the Legislative Counsel of the House of Representatives, and his staff attorneys who provided extensive support. The exceptional staff for CBO and the Office of Legislative Counsel plays a fundamental role in the legislative process, and we could not have done it without them. I want to have a special thank to both the majority and the minority staff who make Energy and Commerce Energy and Commerce has the best members on both sides of the aisle, but we absolutely have the best staff on both sides of the aisle. And we didn't get sleep last night. I know some of these haven't gotten sleep for the last several nights, so really, really appreciate them. We've had a lot of discussions. I appreciate some of the kind comments that I received over the last 2 days and how we can unleash American energy, support American technology, and strengthen Medicaid for the American people. And as we get ready to close, I want to thank all of our members for both Republican and Democrat. We're all very passionate about these issues. We want to make these programs as strong as we can be in the way that we see them. And I want to thank most members of both sides of the aisle, and we heard some really good talk amongst ourselves. And so we'll just put this together and let's find ways to work together. And I commit that under this chairmanship, we will find ways to work together and get big things done. I will go to the ranking member, and then we will vote, and everybody can go about their business.
Well, I certainly agree with everything you said, Mr. Chairman. It obviously is not always easy to be in the opposition, particularly on this bill where we pretty much opposed everything that you were proposing here tonight. But I do think we made a good fight, and we certainly fought in a way I think that the opposition should. And I want to thank everyone, all the members and the staff, for a job well done. Thank you again.
Okay. So the moment we've all been waiting for the last 26 hours and 24 minutes. I move that the committee do now transmit the recommendations of this subcommittee, approved as subtitles A, Energy, B, Environment, C, Communications, and D, Health, as amended, and all appropriate accompanying materials, including supplemental, minority, additional, or dissenting views to the House Committee on Budget in order to comply with the reconciliation directive included in Section 2001 of the concurrent resolution on the budget for fiscal year 2025, H. Con Res 14, and consistent with the Section 310 of the Congressional Budget and Impoundment Control Act of 1974. A roll call has been requested, and the clerk will call the roll.
Mr. Latta? Aye. Mr. Latta votes aye. Mr. Griffith? Aye. Mr. Griffith votes aye. Mr. Bilirakis? Mr. Bilirakis votes aye. Mr. Hudson? Mr. Hudson votes aye. Mr. Carter of Georgia? Aye. Mr. Carter of Georgia votes aye. Mr. Palmer? Mr. Palmer votes aye. Mr. Dunn? Mr. Dunn votes aye. Mr. Crenshaw? Mr. Crenshaw votes aye. Mr. Joyce? Mr. Joyce votes aye. Mr. Weber? Mr. Weber votes aye. Mr. Allen? Mr. Allen votes aye. Mr. Balderson? Mr. Balderson votes aye. Mr. Fulcher? Mr. Fulcher votes aye. Mr. Pfluger? Mr. Pfluger votes aye. Mrs. Harshbarger? Mrs. Harshbarger votes aye. Mrs. Miller-Meeks? Mrs. Miller-Meeks votes aye. Mrs. Kamick? Mrs. Kamick votes aye. Mr. Obernolte? Mr. Obernolte votes aye. Mr. James? Mr. James votes aye. Mr. Benz? Mr. Benz votes aye. Mrs. Houchin? Mrs. Houchin votes aye. Mr. Fry? Mr. Fry votes aye. Ms. Lee? Ms. Lee votes aye. Mr. Langworthy? Mr. Langworthy votes aye. Mr. Kane?
Obviously about to pass.
Mr. Kane votes aye. Mr. Ruley? Mr. Ruley
The
votes
process
aye.
in the House
Mr.
is
Evans?
not done.
Mr. Evans votes aye. Mr. Goldman? Mr. Goldman votes aye. Mrs. Fedorchak? Mrs. Fedorchak votes
entire
aye.
House will have to pass.
Mr. Pallone?
The entire
Mr. Pallone votes no.
reconciliation package
Mr.
that
Gatt?
gets put together.
Mr.
We
Gatt
will, of
votes
course,
no.
fight
Ms.
back.
Schakowsky?
There.
Ms. Schakowsky votes no. Ms. Matsui? Ms. Matsui votes no. Ms. Castor? Ms. Castor votes no. Mr. Tonko? Mr. Tonko votes no. Ms. Clark? Ms. Clark votes no. Mr. Ruiz? Mr. Ruiz votes no. Mr. Peters? Mr. Peters votes no. Mrs. Dingle? Mrs. Dingle votes no. Mr. Veazey? Mr. Veazey votes no. Ms. Kelly? Ms. Kelly votes no. Ms. Bradagan? Ms. Bradagan votes no. Mr. Soto? Mr. Soto votes no. Ms. Schreier? Ms. Schreier votes no. Ms. Strahan? Ms. Strahan votes no. Ms. Fletcher? Ms. Fletcher votes no. Ms. Ocasio-Cortez? Ms. Ocasio-Cortez votes no. Mr. Auchincloss? Mr. Auchincloss votes no. Mr. Carter of Louisiana? Mr. Carter of Louisiana votes no. Mr. Menendez? Mr. Menendez votes no. Mr. Mullen? Mr. Mullen votes no. Mr. Landsman? Mr. Landsman votes no. Ms. McClellan? Ms. McClellan votes no. Chairman Guthrie?
Aye.
Chairman
Is
Guthrie
anyone
votes
here
aye.
seeking to answer the roll call? Seeing none on the Republican, any on the Democrat side? Seeing none, the clerk will report.
Chairman Guthrie, on that vote, there were 30 ayes and 24 noes.
The ayes have it, and the motion to transmit is agreed to. Thank you. Without objection, staff is authorized to make technical and conforming changes to the matters considered by the committee today. So ordered. There is birthday cake from our 71-year-old friend from Alabama, so feel free. Without objection, the committee stands adjourned. There we go.
We will obviously keep fighting. This has to go to the full House, and then it has to go to the Senate. And we are not done. We'll continue to provide our best analysis and information on how to fight these devastating cuts to Medicaid. Thank you for following along. Thank you for caring about Medicaid. And you can follow Little Lobbyists on Facebook, on Blue Sky, on LinkedIn, to stay in touch with our content.